It's Tuesday morning. The horses are almost here. It's buyout. I'm going to tell you a whole lot of almost. So it's almost Christmas. The horses are almost here. We're almost done with the quarantine barn, but we're actually going to be using it today. The new quarantine intake assessment barn. Absolutely. It's going to be, well, it had the first horses in it earlier this morning, and the horses from the buyout are going to be here soon. And I'm just so excited to be saving lives today and enjoy this almost live. It's the December buyout rescue mission, and we've got at least 21 horses on their way. How many are going to show up in the end? I really can't tell you. It's always a mystery. I'm surprised, but just come along on this journey with me and let's save some lives. Oh, and it's almost Christmas. So this is really our Christmas rescue mission, and I hope these horses, you know, coming here, they're definitely going to have a better Christmas than if they're still in the slaughter pipeline, because the slaughter pipeline is not good for anything. It's not good for the horses, not good for the people. It is so full of cruelty and inhumanity, and it needs to be shut down. Not happening this year. 2025, hopefully it happens. So let's save some lives. They're almost here. Like I said, they're almost here, so let's get this done. Let's get some horses saved. Alrighty, here's one of the ones that came off the trailer. Another two. Pretty horses, more coming off. It's a little bit of a mess getting the horses off. I wish it was a lot smoother today. That horse has got some snotty nose.
How much is that one?
It's the first horse coming in. Yeah. What a pretty horse. And you're the first buyout horse in our new quarantine assessment and intake barn. What a pretty horse. This little one's getting moved on down. This one's completely blind. It's going to be put down here in a pen by itself where it can be completely safe with some nice fresh water. Getting the horses sorted. Hi, guys. You got off that nasty trailer, didn't you? Now you guys are safe. This one's bypassing everything, going straight to the stall in here. She can get it. Kind of walking a little goofy, but this is all of our new setup. Precious little draft.
Hi, girl. You so tired?
Dr. Lydia's going to be checking her out. Just trembling with exhaustion.
Easy. Ooh. 80. That's just muscle fatigue right there.
Did you look at her teeth, Dr. Lydia?
I have not looked closely at her teeth. She is quite older.
Okay.
I'm worried that she's in respiratory distress because she's got a mask. Can you smell the infection up there in her face? Yeah. So we're gonna wanna get some head radiographs on her, but let's let her just decompress and get a drink. Got blood. We do not have photos that I know of. Her heart rate is 80, and she did get 10 cc's of Banamine, but I had to give it PO.
Alrighty, Dr. Lydia making sure her patients have some food and some water. Keep everybody happy, give them some nibbles.
Hi, little cute blind one. You're so adorable. Here, Tim, hey. Here you go, sweet thing. Okay.
Alrighty. Here's the next trailer. And hopefully these guys are all standing and doing good. Come on, babies. Some big horses in there.
Those are big.
Yeah. Come on, guys. You've got it. Oh, this one is so skinny. Y'all, look at that. No, not okay. So incredibly skinny. Alrighty, there's a few more coming out. Two more, it looks like. These are our Christmas babies. Come on, guys. Little one's like, I want out. I don't know about you, but I want out. So there they are.
This one is really vision impaired, but I think maybe partially visual. Maybe. Hi, babies.
One thing I can say is this barn is working exactly like we wanted it to.
Haley, this is just a regular size halter. We can get you a bigger halter. Yeah, this one is vision impaired a little bit. Just be careful. And also teeth. Look and pull out anybody that needs pain meds and get pain meds on board as quickly as possible. And then once we're like, nothing is suffering to the visible eye, then we just, oh, Cribber.
She's blind.
Well, she's probably spent a lot of time just standing in one place having nothing to do. Yeah. And I love that they're not like milling around fighting for water, or like we could put the little blind one. Oh, I know, buddy. He's got contusions on this eyelid. You got hay in your eye. Can I get it out for you? I know. It's the least of your concerns, but. Nobody likes hay in your eyeball. You good boy. Did you guys get a picture of this brand?
I've not gotten any photos. She didn't get a picture of it, but I wrote it down.
SLM 47. Go ahead and walk him through into the chute if that's okay. Dr. Gina. Oh, yeah, okay.
All right, Tawny getting her photos. First buyout horse going through the chutes. He's like, I can't fit underneath that. Don't do that.
Here. I'll take this and you get out. Yeah, wonderful.
We're at 980.
980.
980 pounds.
Good boy. Let's keep going a little bit, sir.
Let's keep going.
You're okay. I mean, you can hang here for a second.
What is that?
This is very, very loosely tied. I'm sorry, I know. Good boy. We can look at your teeth. Oh, you're not very old. He's only like 10 or 11. Oh boy, hang on a second. That tooth looks like 10 or 11. This tooth looks closer to 15. You're a good boy. Okay. Did we put blood for a CBC in a tube? No, okay, I'll pull. I'm gonna call him 11, but for his Coggins purposes, because he's branded, dental aging is very subjective. So we're gonna confirm based on his brand because he has a registered date of birth. Also dental aging, we do it really quickly during triage on intake by looking at Galvani's groove on those incisors, but what we're supposed to do is look at the cups and stars and look at all the occlusal surfaces. So when I actually do a more accurate aging, we look at all of the teeth and we take dental radiographs. In this guy's case, we have a ballpark. We're gonna confirm that age before we send his blood sample out tomorrow, but he's young. I don't see anything significantly wrong visually anyway, and he's had a really traumatic morning. He's got muscle fasciculations because he's really fatigued from being down in that trailer. Dr. Gina already gave him pain medication intravenously, so we're gonna give him kind of the things that he needs to be processed and turn him out and let him decompress.
So in addition to all these amazing shoots, we can actually go down both sides and treat the horses from both sides simultaneously. So pretty amazing. Ready to take some x-rays here. Who are we x-raying?
This little mare that was down in the trailer is in respiratory distress, so she's got difficulty breathing in and out. She has a really foul smell coming from her nose and mouth, and she's got a really hard bony area. My hands are really dirty. She had some pain medication, and we wanted that to kick in first, but we're gonna take some x-rays of her head to see whether she has a tumor or an abscess and what her teeth look like, but we just wanted to give her a minute first, but she's our next priority. Hey, Mama. Oh, you're such a good girl. Hey. You're a good girl, I know. People don't mean good things, huh? I'm sorry. Good girl. You good girl. Okay. You just gotta look at your head. You wanna come this way? Woo! You guys smell that? Oh, I'm sorry. She's thirsty. Oh, girl.
It's like, oh, that's where the water is. I was there the whole time.
Oh, it's just heartbreaking. You okay? Good girl. I wonder what the average number of swallows for a horse drinking is. That was 34. So usually we shoot left to right. Yeah. Well, we're going, the mass is on the right side, and it's kind of like right here. You're a good girl. And I can sedate her if I need to, but I kind of don't want to with how she's breathing. Oh, I'm so sorry, you guys. Hang on a second, I got a trick. Movement. All the movement. Okay, let's try that again. Ooh, good girl. Much better. What's that? See how she's breathing? So you're gonna hold the plate. Yeah, perfect. Okay, ma'am. Whoa, I have little control over her head. Good job. You wanna try top down?
I don't know.
She's little.
That's why I was like, maybe she's a draft cross, but that's why I crossed it out.
She looks like a little halfling or something. Whether that's ingesta or purulent material, it leads from a dental fracture up into the sinus cavity. but it's rock hard, so.
You're only taking dental.
Hi, sweet girl. I will give you an age right now. You're such a good girl. Did we document mucopurulent nasal discharge? Oh boy. Oh, honey, your mouth smells so bad. 30s. Galvani's groove is absent, so maybe 33, 34. Okay, you want some more hay?
So 33 or 34, Dr. Lydia says.
Yeah.
And,
You thirsty still, Mama?
so not terrible shape for an elderly horse.
Our receptor batteries for our radiograph plate are a bit aged. We've replaced a lot of the other parts. Thankfully, we have 4 of them, so Dr. Gina is going to swap that out. We didn't get a good look at her rest of her teeth, but what we found out was that she has a fractured tooth. I think number 7 on the upper right is fractured and mostly missing, and then there's a hole between that going up into this area that's probably this big. In her sinus cavity, we can't tell from the x-ray whether it's a abscess packed with inspissated pus, those are called chondroids, or whether it's a tumor. The appearance on the x-ray is very similar sometimes with different pathologies, but based on the smell coming from her mouth, she has abscesses somewhere. So we're gonna take a little bit of a closer look. I also want to check her resting heart rate. Her heart rate was crazy high, but she was down in the trailer and she had a hard time getting up. So we're going to make sure she's comfortable and make sure she doesn't need more pain meds.
All right, look at this cute little horsey coming up here. Completely blind. Both eyes completely blind. Poor baby. And
Oh, so cute. Maybe? What do you think, Tani? Acne? Very well adjusted. I have not done anything to this horse. I don't think we even have blood.
I'm doing both, y'all. I got the lead rope with the blind baby. Don't know that it's a baby. It's like a Hackney pony. But anytime a horse is little, we like to call him baby. And completely blind, but very well adjusted, paying attention. And Dr. Lydia is gonna come do an evaluation.
I got a soft spot for blind hackneys.
But do you have a soft spot at your house for a blind hackney?
Lynette does. She adopted Bo, whose name is now Arthur.
Aw.
And he's doing great. He trots around with his fancy show gait and runs the field. Okay, you're very aged. Can I see your teeth one more time? Oh, we're missing some incisors. I know, I'm checking your teeth. I think we might have to like sedate and look at the rest of teeth, or maybe just shoot a dental rat. Do we have a battery?
So this new person is actually, our longtime fans might remember, she adopted baby Benjamin years and years and years ago. And she's actually in a vet tech program, and she's here shadowing the vets and learning more about the field.
You're a good boy. Nope. Yeah, you're doing super great. Make sure you're on the same side as your person, and you always want to make sure that they're communicating with you. So I'm going to tell you, I'm about to poke him. Sleepy. You're a good boy. He's going to be very rude. He's got pretty decent teeth. Oh, man. All right, Dr. Gina, I'm going to need you to weigh in because, oh, he's a cribber. This is why his incisors are terrible. So the tooth that we normally use to evaluate isn't there. So let me show you his back teeth. He's got like a pretty decent amount. He needs a dental, but he's got a pretty decent amount of teeth left, tops and bottoms. Not horrible.
I know you guys can't see the scale, but this horse weighs in at 1,400 pounds. So 1,400 pound horse. I'm 6 foot. Hold on here. And this horse towers above me. And yeah, big, big, big horse. Unfortunately, let me show you here. Back feet are in horrible, it's just horrible condition. And it'll be interesting to see what the vets say, but there's something serious going on with this horse's back foot.
Good girl. So obviously this is massive neglect right here, but what we don't know is if this mare is super, super off on this leg just because her hoof is overgrown. It should end about here, or if she has something else major going on. She's very, very lame on this leg, but picture having a slipper like a foot off the side of your foot. It would make you walk strangely. So she's only about 16 or 18. Unfortunately, we basically never get draft horses that don't have a major problem because people work them as long as they can work. So I think we're gonna pull her out and try to get some radiographs of this foot and get a closer look. She has a great personality.
And she's 1,400 pounds.
Yeah, but this is totally the kind of horse that slaughter buyers love. So I'm really thankful that she made it here for Christmas and not there.
Absolutely, this is one of our Christmas babies. This little guy's sedated. He's going out to his pen. All of his assessments done. Dr. Lydia was saying that he's going to have both eyes removed. He's blind in both eyes, but he's going to have them pulled out under surgery. And but he'll be doing fine after that. So this big, beautiful boy came out of the chutes. And oh man, that's so bad. So bad.
Dr. Gina, I'm going to wait to poke her until I know whether or not we have batteries. So you always want to be on the same side as your person who's working? Perfect. After 20 years of marriage, my husband and I had the conversation where he was like, you always come to these conclusions. And I was like, I'm not concluding anything. I'm verbally processing. And he was like, oh yeah, these clippers don't work. So this sweet mare is probably about 34 or 35 years old. She was down in the trailer. She tried really hard and got up. And she right away wanted to start eating. You can't smell on camera, but even from like 10 feet away from her, you can smell the smell of infection. So we took some x-rays, and you can see this big area on her face right here extends all the way into the cavities and the bone of her face right here. Based on x-rays, it looks like a tumor to me. I think it also has a degree of infection. So sometimes tumors overgrow their blood supply and then they get an area of necrosis, which means that tissue dies. In her case, she had a fractured tooth that led up into her sinus cavity. And so whether she started with an infection or she started with a tumor that eroded that bone and that tooth, we don't know. But in her case, her heart rate came down significantly with pain medication. So she's stable for now, but you can still hear her and you can see her breathing effort as she flares her nostrils in and out. So she is an older lady. She's got a raging infection and pain in her face. And the kindest thing for her to do is to give her the last act of kindness. I don't think that we could safely, or that any surgeon could safely, resect a mass that's as large as this one that's affecting this key part of her face. Horses are obligate nasal breathers, so they can't breathe out of their mouths. They have to breathe through their nose. And we can see that this tumor is affecting her ability to breathe already. And so she's gonna get some good treats, and she's not painful. She was so hungry and thirsty, so she's gonna get some good time and some love, and we're gonna let her go. So normal horse breathing, you can't hear it. You good, Elena? I'm gonna try to get her to pick this foot up. Can you pick it up, big girl? I'm gonna shove her over a little bit. Okay. I'm gonna square her up a little bit in the front too. Good girl. Good girl. Come on, Mama. You can do it. Can you see the back or take a picture real quick? I just want to see the bottom of her foot while we got it up. Sorry. Great. Okay, I'm going to let her put it down.
I don't think anyone got it.
All right, well, that's all right.
We almost got it.
I can pick it back up again. Yeah, ready? I just, like, do we have an obvious mass or canker or... Okay.
Okay, wow, photos, videos, we're doing it all.
Do you want to do? Wow, it's very overgrown. Okay, Nicole.
Keep your foot there.
I think the safest thing for you to do is just set the plate right there. Dr. Gina, I didn't need to steal this jab. I would put this all the way in the ground. Right there, yeah, perfect.
This is going to be an interesting x-ray. Maybe. Hopefully the x-ray shows
bit
no
of
bony
movement.
problems and just a little issues.
Just neglect.
And also hopefully
Yeah,
the
you can
x-ray
move
works.
that. It says it's acquiring.
Usually it beeps by now.
We got no lights on this.
Do we need all new batteries for our plates? Is that
We need, I mean, those batteries are like $300 each, so it's not the end of the world to get more. I'm gonna take a risk and put my face. I mean, that could just straight up be like, okay, let's try again. Receptor not present.
That's what happened last.
Receptor battery 0%. But it's on, so it shouldn't be saying that. Do you want to just turn everything off and turn it back on again?
So
That's the only thing I know how to do.
folks, we need more batteries. They're like $300 a piece. And
Well, that was when I got a quote in January of last year, so they're probably more expensive now. But the company that owns this equipment cut us an amazing deal last time we had an issue. They gave us a whole new thing of this.
next course coming into the chute system. Don't go in there, bud. Gotta get photos of you. Have just a 30-second explanation of what DSLD
Sure.
is.
DSLD stands for Deep Suspensory Limb Desmitis. It is a heritable, chronic progressive condition that causes initially just like a abnormal conformation of the leg, but over time, as the tendons and ligaments stretch abnormally, they cause chronic pain that becomes more and more severe. And in the worst cases, the joint drops completely and touches the ground. And in this little girl, she's only 2 years old. She has DSLD in both hind legs and the left front. But when she's weight bearing on those hind legs, her joint is like less than an inch off the ground for a 2-year-old. So I had a percher on in his 30s with DSLD. He was on 3 different pain medications, and I wasn't able to keep him comfortable after about a year, even on those 3 pain meds. So it's really unfortunate. What's heartbreaking is it's not really difficult to see DSLD, and people choose to breed those animals anyway, and then you end up with adorable babies that are facing a life of chronic pain, and there's nothing we can do about it.
All right, so this is the PD view. I shot it from behind the foot to the front, and if you see on this medial aspect, this bone of the P3 is pretty involved, and I got another view of it to make sure it's really there, and you can see that it's repeatable in both views, so I think it's more than just mud trapped in there or on the skin or anything like that. So Dr. Lean, I think that that's bony involvement to show why her right hind is so abnormally shaped.
So not a good thing.
No, bony involvement like that is never great.
That's a bummer. Such a big, beautiful horse.
She is. But Tony's got great hunches, so. Haley's
got pizza. We've got pizza. The This is an awesome, awesome thing. Lots of pizza. Is that Christmas cookies?
Oh, it's fudge.
Christmas fudge. Oh boy. Gonna be a lot more happy people up here, and a bucket of tools. Not as exciting as pizza though. We had an amazing bunch of pizza for lunch. I'm going to show you some funny pictures. So we have a new media guy actually doing his working interview today, and he took some funny pictures for us. So we'll see how y'all like those. But lunch was great. Thank you to whoever donated for today's pizza. I know somebody donated for it, so thank you so much. And yeah, and Tawny says, don't forget to donate to the Pizza Fund, because we don't want that to run out and our poor intake staff start starving. So we're gonna get back to work now, and they've already started on the big draft, so let's go catch up with everyone and see how it's going. Your head's on the wrong side. 875. Here, this draft is
Sorry, I was trying to be helpful. Okay. Easy, good girl. All right. Hang on. We can't take one because neither of you guys have lead on. All right, here's what we're gonna do. Just go. I got this. Yeah, Haley, get out of here. Seriously, it's in position. Do you want to put it on the ground off the thing?
No, I can't because the other foot
Got it.
is right there.
Okay. Yeah. Woo! All right, so we didn't get the full bottom of the foot, but this line and this line are supposed to be parallel to one another. So if we follow these two lines, we have a greater than 40-degree difference. I would love to get, so she's got rotation. Let's try to, hang on one second, before you move her, let's do this. A gross clump of disgustingness. Can you put the plate right in front of her foot? Haley, I don't want you to be there because I don't want to hit you with that much radiation. Yeah. Let's see if that was diagnostic. So she's got sinking as well as rotation. Angle of rotation.
So you want like in here?
A little bit more this way. Yep. Go ahead.
I don't know if it's far enough.
Yeah. So you can see
You got it?
this is just the plate. Yeah. So this is the angle of the hoof, and this is the degree of rotation. So she has severe sinking and rotation of that coffin bone. She also has a lot of arthritis, so all of that. Not compared to an elephant, but compared to a horse, yeah. So that's probably why she's got, these are called founder rings. See these long growth rings right there? So that's a sign of metabolic disease. It can happen from periods of starvation or periods of overfeeding, but see how it kind of like runs up and down? Yeah. Thanks a lot, ma'am. But that's probably why she was so painful. Look at all your birds. Hi, Mama. She's got a mass on this eyelid. I know, is your mouth painful?
Most of the time, or broken babies. If you want to put the stethoscope right there, she has a beautiful
Why is she standing like that? I don't know. I gotta look on the other side. This side, I would say 23. She's got either a mass or a scar in this eye.
Did you hear that? That side sounds beautiful. This side was the one.
Do you see through her pupil?
She's got a dye.
Right on her lens. And then she's got a mass on the right on this upper eyelid.
She's standing right.
She seems really painful on her pelvis.
Okay.
Haley, I think she's really painful in her hind end, so just be careful. See how she's walking and like trying to hold her hind legs underneath her? Let me grab her some pain meds. Can you just walk her that way and back for us? Oh yeah. That's enough, Haley, that's enough, yeah. So this sweet old lady, I think is about mid-30s. She's missing most of her teeth, so it's really difficult to tell. She's super sweet. She ate a bunch of pizza. She's one that was deceptive because she looks really calm and comfortable, but her resting heart rate was 78. So upper end of normal is in the upper 30s. So she was having severe pain, and if you watch when she walks, she seems really uncomfortable on her front feet. We immediately gave her IV pain meds. Sometimes I forget to say that. Everything gets pain medication. What you can see from the outside in this mare's feet is that she's got severe neglect, and she's got these rings and kind of an abnormal shape to her foot. So you almost can tell in some cases without an x-ray that the coffin bone should be oriented a certain way and that the hoof growth is a different way. And that's important because the little laminar structures that interdigitate and hold the outside of the hoof to the inside of the hoof can only undergo so much strain before they start to get inflamed and tear away from each other. And that's when we have the inflammatory disease that we call laminitis. So we took some x-rays on this mare's feet, and we found severe angle change greater than 40% and sinking. So those are two things that are very important. You hear Dr. Gina and I talk about laminitis a lot here at Horse Plus, unfortunately. Laminitis is a condition that if we catch it early in an acute phase, we can work really closely with farriers, with corrective shoeing, with anti-inflammatories, and we can manage horses through those things. Laminitis is often associated with metabolic disease, so we have no history on this mare. We don't know what caused her to have a founder episode, but we know that this is severe and advanced and that she is very painful. So we're gonna give her the last act of kindness. She's had lots and lots of cookies, but it's so heartbreaking. She probably worked every day of her life. She's had a lot of foals. She has a lot of scarring in her vulva and a lot of evidence of historic mammary development. She's a good girl. So we're gonna give her the last act of kindness. You know, my hand is cold. I think that's a scar. Yeah, I don't feel testicles. You're a very good boy.
He's curious, he's respectful, he's been through multiple auctions.
Yeah.
And he doesn't have his two-year-old teeth yet.
It's really
His
cold
eyeballs.
and you're very nice
He's
and
like,
warm.
I don't like
My
this
hand is
lady.
cold, and he was like, ooh.
She got up and close and
Hi.
personal, and she didn't ask permission.
I'm about to stick something in your nose.
Uh-oh. Uh-oh.
You got a little bit of a gunky
If you're looking for a
nose.
nice young prospect horse, this is your horse. He seems really, really
We
awesome.
don't have an age on him yet.
Well, he doesn't have his 2-year-old teeth yet. that I
Younger
could
than
see.
2.5.
So he's a youngster, and he's going to be very tall. And she just got some boogers out of
Could
his
have
nose.
a bit of a.
He had a little bit of a cough, I heard. Don't blow on me. Haley, when you're done with the pizza,
I feel like I should say, ooh, I got some of your snot in my face, buddy. That my hands are dirty and I should go wash them.
Everything's going really, really well. The
facility is working great. You can envision stuff on paper and to see it in action, and so much nicer working conditions. Like if we were up in the little barn, there would be a breeze blowing through, it would be cold. The horses would be standing in mud. If it started raining, they'd be in the rain. They're all under cover. There's no mud. It's just fantastic. Through the jail work program, one of the women has experience with horses, and so she's up here helping us as well. Can't be filming, but like if a horse goes poop, whoop, it's gone, and in the muck bucket and stuff. She's doing a great job. So we're really excited to have this program here with this new facility, and it's going to make our intake so much better for the horses and for our staff.
So this sweet lady is about 23 years old. She has a very significant systolic heart murmur. She looks like she was used as a broodmare and just kind of cast away when she wasn't useful to people anymore. She's got extensive scarring on her vulva. She has a mass inside her left eye and a little mass on the outside lid of her right eye. But most significantly, she's got evidence of really significant pain. You can see when she stands, she kind of hunches her lower back and pulls her legs underneath her, and she also failed proprioceptive placing, so her brain can't tell where her pelvic limbs are in space. There's a lot of different indications for neurologic disease, but when a horse becomes neurologically abnormal, especially in an advanced age, none of those differentials have positive outcomes or have particularly good quality of life. Sometimes they can for a little bit. So at her age, and especially because we're concerned about multiple disease processes, we are recommending the last act of kindness. Look at this mane.
It's another draft horse.
Yeah.
What are you seeing on this guy? Or girl?
I haven't looked at his teeth yet. This is a gelding. He's got cataracts for sure. Hi, buddy. He can still see, but he's got some reduced vision. He's got an elevated respiratory rate and effort. And that is all I have observed so far. Hi, sweet boy. He's a really good boy. But he's a pretty decent body condition score. I think he's quite old. Is this our best way through?
Yes.
Okay. You're such a good boy. He also has bilateral cataracts. I know. You're following me and you're doing such a great job. We're going to have to swivel. Good boy. Very good. One more step. Come on. Come on. You're okay. It's not a trailer. Good boy. Good boy. One more step. Good boy. He's like, All right. You need a minute. That's okay. I actually am just trying to get you out this door here, so.
No, we want his weight while he's up there, hopefully.
Yeah, I mean, it would be great. I'm just showing him there's a way out. See? Here we go, buddy. Can I have some treats? And then Haley, as soon as he's out here, I'm going to hand him over to
800
you.
pounds on his front leg, so.
This horse wins the Mustache of the award, Mustache of the Day award. And also, look at his teeth.
Oh.
Isn't that the cutest old man face you've ever seen? Hi, sir.
She
Want
just
some
called
cookies?
you old.
I mean, he is. What is that? It's always really sad when these old guys like have never had treats. Yeah. Are they terrible? Come on.
I think you are ungrateful.
All right, Emily, I'll switch with you. Thank you. These drafts. Does anybody want to volunteer? I'm going to grab a leader rope and see if this baby with the halter on is trained to lead. Hi, I should have brought some cookies. Okay, people are not trustworthy. That's fair enough.
So skinny.
I think actually this baby might be visual on the right. Look how bulgy that left eye is. It wants to come out.
So nice without mud and dirt and slime everywhere.
It's his boyfriend, just to be clear. I don't know if this halter is...
Dr. Gina's trying to stay warm. It's cold. And in the middle of it all, we find out 3 more horses are here. So we actually have a trailer pulling up right now. We have 3 more horses coming now. So, wow, awesome. Christmas surprise. And be super exciting to see who comes off this trailer. Oh, Palomino was blind. He's got paperwork up there. He's trying to hold it out the window at us.
See how the head's kind of, I say it.
Completely blind, not well adjusted. Tawny needs a halter and lead.
Sorry, this is kind of ours, but it was yesterday. She's not really well adjusted. Okay. Oh, poor thing. Let me go, Tony, if it's okay, can I go grab some pain meds? I know those eyes are probably really hurt.
So 3 more horses coming off the trailer. We're able to save these thanks to donations, and I would like to say we had plenty of donations, but unfortunately we haven't. So we need more donations, and we need your help. These 3, we were not expecting to get them today, but it's a Christmas miracle. These 3 precious horses are here, and they're safe, and they're not going to be going down the slaughter pipeline, and not going to be slaughtered. So thank you guys for your support, and hit that donate button. Even $5 helps a lot. So thank you guys so much. But 3 more horses, so I believe we're up to 23 now.
This poor gelding is blind completely. We can see the way he's kind of looks anxious and is looking around and can't see. Whatever etiology caused him to lose his vision, secondary to that as the eye shrinks, the lids curve in, it's called entropion, and then they rub against the cornea and they cause severe ulcers. The middle of his eye, you can see a circle that kind of bulges out. So that was probably a desmetocele, which is a melting ulcer that ruptured through the cornea, and that is incredibly painful. The pressure in your eye, your optic nerve goes directly to your brain. So any change in pressure in the eye can cause severe debilitating headaches and pain. And this poor horse has the same situation going on in both of those eyes. So he either needs expedient euthanasia to alleviate his pain, or he needs to have surgery like today to alleviate the pain in those eyes. He just got off the trailer. We haven't looked at him closely. He's got some mucopurulent nasal discharge, so we don't know what else is going on. I did already give him IV pain medication, so we're gonna let him decompress for a minute. Often the blind horses that come in are really desperately thirsty because they haven't been able to access water. So we'll make sure he has access to some food and water, and kind of take things from there.
I think, I'm going to stand take this for a
Yeah.
second.
Please do.
Earlier, the little Hackney pony that came through, you could tell that little pony is very well adjusted. It wasn't scared. This horse is pretty traumatized. So It's really hard. Each blind horse that comes in, we evaluate because none of them are the same, and we have to figure out. It's the paint, black and white. Nasty cough. But yeah, buyouts are rough, and we try to do the best we can for each and every one.
Come on, baby, you okay? You want to go this way? You're all right. I know you can't see me on that side. Come on. Oh, you're so cute. Hi, sweet
Trying to get the little horse out.
You're all right. Come on. Come on. Here you go.
There we
Good
go.
girl. Good girl. Here we go. Keep it going.
Ah, blind on my side. Okay. I gotcha. Completely blind.
She can see
this.
some out of the right, I think.
Yeah.
Good girl. Yeah, she's not completely blind, I don't think. Okay.
Dr. Lydia and Tawny were out there wrangling the new horses. The rest of the vet team was in here doing some x-rays.
Well, there's just nothing there, huh?
Yeah.
Oh yeah, we got some teeth up there.
Looks like there's something in
Yeah,
there.
definitely needed dental.
There's-
But I think what I was looking for was, are there teeth? Like, do we have any, like this looks like periodontal ligament, so we might be really close to the gum line.
Isn't that it right there?
We're gonna have some workplace violence here
Right
soon.
up here.
Maybe. I don't know. Is that it or is it this one?
And
right
don't
here?
worry, y'all. I'll be here to film
I
it.
got a review, I don't know. Now I'm second guessing myself.
There's that one. There's
Yeah, ooh.
This guy is gonna get his dental. Dr. Lydia is gonna do his dental. And get him all good and going.
He has no tooth. You're a good boy. Okay. Look how cute his little gums are. We haven't used this on a horse with no incisors yet. Oh yeah! You got tooths back there? Oh boy. Is that a fracture? All right, I'm going in. Yay, not a fracture. Holy moly, that's sharp. Good boy, I know. Very fixable. Awesome. Okay. Haley, I'm gonna try not to get you soaking wet. Here, move your body over. Just, I don't even need his head up right now. You can put his head totally down. Yeah, there we go. Okay.
He had other ideas.
Oh, Haley, no. Every day. And then it's always my fault. Are you gonna need more drugs, dude? I love this sound. Haley, I'm really sorry.
The cleanest I've been.
Oh, that's gonna feel so much better, sir. All right, I gotta do a little bit on the bottoms and then we're done. Can you get a tongue out on either side? Take either side. Sorry, I can't see, so I gotta just feel. Yeah, I think I got that side.
Taking a picture of me.
Perfect, okay, tongue out the other side, we're almost done. Thank you. Oh, you're gonna feel so much better, sir. Don't spit it on Haley. Haley, move out of the way.
At this point, I'm
Look, he's, like,
beginning to think it's a
moving into her.
conspiracy. You might as well just spray Haley in the face with it, the rest of it. Like,
I mean, I have. Haley. Okay. Okay, she is getting tortured.
that's how she
All right.
experiences love.
I think I
somehow.
jumped the
don't
gun with
know.
this horse. Okay, so we.
Y'all give a thumbs up if you think Haley should just go jump in a water trough now.
Oh, I'm gonna go get a towel and dry her off. I'm finished with those. We can theoretically reuse this if we need to, so you can just set this bucket over here.
So we've got 2 teams working. We've got Haley over here with Nicole, our new registered vet tech. And then we've got Keith and Dr. Gina working this horse in the chute. Emily, Caitlin, Dr. Lydia, and we've got Tawny over there, and then we've got me. So we're a busy group up here, taking care of these horses that just came in. Tawny's getting photos on this one. This one's completely blind and not really well adjusted. Standing there tied, but we'll just have to see what the vets say is a good prognosis for this horse.
Blind horses are always so challenging. We do a number of different tests, and anytime you touch him, he flinches. And watching him we have these great windows so we can watch and see how they're interacting, and it's just not a good situation for a horse at his age to be this fearful. When walking, he's very, very scared, and we very much stand by the 5 freedoms. That if a horse is not living those 5 freedoms, that we need to make that call. And living in fear is definitely not fair for a horse. They're fight or flight animals, and for a horse to be easy, blind, and living in fear, easy. You're all right. You're all right. Easy. It's really not fair. But Dr. Lydia could explain a lot more about the 5 freedoms. Easy. It's really hard, but we're really thankful that this horse was able to come to us.
That is a great question. Let's take a look. Yeah, let's.
So he's done. He passed all the assessment, and he's going to go out and hang out for a while before they're turned out to pasture this evening. He's got to figure out where he's going.
Yeah, I think if we get more hay, I don't want him to eat yet though, is my only hesitation. Is there somewhere safe we can tie him for a second? Look, Haley, why don't you just tie him to this corner right here for a second so we can kind of keep a close eye on him.
I mean, it's empty.
Yeah, I think the mini's a great solution. Let's just give him long enough that if he starts eating hay, he's not going to choke. So let's tie, no. I think this corner right here is our best bet, just for maybe another 10 minutes, and then when he's awake enough, we can put him with the little hackney. Come on, friend.
And now he's ready for his pen.
Well, I mean, he's kind of ready.
Kind of ready.
He's still pretty sleepy. Good boy. Oh, red mare face. Yeah, don't eat too much right now, okay? We don't need you to choke. Good boy. Should we run some cortisol levels on you, my friend? Did we get pictures on him?
Good question.
Because we kind of skipped around. He has a B number we need to check and make sure. Perfect.
710 pounds.
710. You got it. I will get you Cushing's blood. Hi, cute friend. He says, what's about that pizza? What?
529.
529.
It's a building?
Yes. Affirmative. Left hind sock, yep. He just has a lot of white on his face. I would call him like, yeah, ablaze. He also has white over his eyebrows. Awesome, thanks, Emily. Let's just kind of go right here-ish. Perfect. Pony, just pony. Hi, cute friend. Okay.
Stay still.
7 something 9.
7:10.
7.
It was 7:10, I think.
10.
Yeah. 7:09, 7:10, 7:11.
No? Are you weird?
He's an older gentleman. 27. Okay, I know. 26 to 27. You want to try drawing blood? Okay, you can say no if you don't want to. I'm going to talk you through the whole thing, so don't be nervous.
For a Cushing's test, I need a purple top, but if you just
Got it.
want the two
Got it.
blood, it's fine.
Emily's probably the best phlebotomist on our whole team. Okay, so I always.
Dr. Gina's over here taking care of this horse. Pretty little black and white paint. I heard some serious coughing come out of this horse though, so hopefully it'll be okay. We'll have to see.
I'm gonna culture.
I already got a swab.
Sweet. Dr. Gina's so on top of it.
If you move up into her...
How old is she? Okay. Hi, sweet thing. You want to hold her for me, Elena? She's a good girl. Thank you so much.
What's going on with this horse?
Boy, this horse has a lot going on. She looks like she's about 21. So this mare, you can see, has mucopurulent nasal discharge. She has a foul odor to her breath. She's breathing with a lot of effort. So she's really struggling to breathe. Her lung sounds are bubbly, like she's got fluid in her lungs. I didn't listen to her heart, but she has, did she have a murmur, Dr. Gina?
It sounded like each beat had an echo around it. I don't know how to describe that.
Yeah. She has what we call a Heaves line. So you can see on her body right here, she's got an indent that indicates she's breathing with abdominal effort. That's not normal for a horse. So at this moment, we don't know what etiology is causing that. It could be viral, it could be bacterial, it could be fungal, it could be neoplastic. We took some samples from her nose and we took some blood samples, and we're going to try to find out what we think is causing the infection, but she's in respiratory distress right now. She has had pain medication that we just gave her a minute ago, so hopefully when that kicks in, she'll be a little bit more comfortable. And Dr. Gina is going to do a thoracic ultrasound to look at those lungs and see if we can learn. Our ultrasound can penetrate 18 centimeters, so we actually can see a fair amount of the equine lung at that depth. Our challenge right now is winter hair coats, so our best image is when we have really direct contact with the skin. So Caitlin is clipping a little field so we can see a representative sample. We don't want to clip all of her hair coat because it's December and it's cold, but we're going to try to get a better picture of what's going on in those lungs. How come you didn't let me look at your tubes? Listen, I need a clearer look than that. Sir. I'm going to call him 19, but I'm not going to say that's the most accurate dental exam I've done. Okay, I will hold him for you while you get some blood. You'll be a good boy, please, sir, okay?
White paint here in your mouth.
So all those lines that go vertically like that, those shadows, those are called B lines, and those are usually when there is something inside the pleural surface that is causing or casting the shadow, which could be abscesses, it could just be holes, but that's a pretty big one, casting a pretty big shadow right there, or called a comet tail. If I move a little bit forward, you can also see her heart, and you can see how big her left ventricle looks, the wall of it. that's all right above her heart. And I moved so you can see how big her left ventricle looks.
Dang.
Of the
Yeah. So would you call that cardiomyopathy?
Could be.
Like it almost looks like a,
We could Doppler it, or we could do the color stuff. I didn't do that. I was just looking at the.
like to me this looks end stage, and I don't think she's responded to that Banamine at all. Like I don't see any
I
improvement.
think her heart rate or her respiratory rate's increased.
Yeah. Yeah. I would love to learn more if you want to pop the Doppler on, but I feel like diagnostically, this is like I don't want to prolong things for her if we. He's got dental pain.
Like TJ?
Something is wrong in his mouth and his C-spine, but he's like super, as soon as you palpate where it hurts, he's like, oh yeah, he's very soft and open to, yeah.
You want to take rads on him?
Yeah, I would love to take rads. It feels soft tissue to me. And her thoracic ultrasound is, thank you. Yeah, okay.
So apparently the list was longer than she wanted to memorize. So Dr. Lydia gets to do her own note this time.
I choose my battles.
Everything's going really great today. I do want to give a shout out to the work release program from the jail. We're piloting it with women, and this wonderful lady back here has been working very, very hard all day. Anytime anyone makes a mess, she's in here to clean up, and it's really great to have their help, and it's a great program. If anyone's interested in sponsoring a woman from the jail, they can come out and work. Just contact us. We'd love to get more folks out here helping, and how great it is to be helping with horses, and just everything involved with that is a really great program. So getting lots done here, and we're really thankful for all the cleanup that's happening.
Haley or Emily, can one of you guys grab this horse out here for me, please? Thank you.
The violence continues.
You want to just walk him right over here? He is real handsome. Hi, you have a tiny, tiny star. Did we document that this horse has a tiny star?
5 ECB6, right? I'm not crazy.
Don't smash my hand, please.
Who, what?
This says 5 ECB6, right?
8-6.
8-6?
Yeah.
So nobody-
it could be a B, but it easily could be
Did
an
Dr.
8.
Jean already do anything?
You can see out of this side.
And since I'm here anyway.
Standard bred.
Okay,
Were you able to find his info out?
I'm trying to.
I'm coming.
They make me put in a code every time I go.
Oh, yes.
KY5.
Ready? I'm poking.
Good boy. Okay, so this boy's name, I looked him up. His name is Wonder Boy Trent, and he just turned 17 this year. He was born in March of 2007 in North Carolina.
You're a very good boy. Haley, I'm going to try to pick this leg up.
Today's buyout went so well. It's the Christmas buyout rescue, and we were able to save 23 precious lives from the slaughter pipeline, directly out of the slaughter pipeline. They came here. It wasn't all pretty. There was definitely some horses that had a lot of problems, and some of them literally had to have emergency euthanasia upon arrival. But thanks to your support, those 23 horses did not continue down the slaughter pipeline. They came here to Horse Plus. They were kept safe. The vets got right to work. We had 2 vets. We have a registered vet tech. We have vet assistants. We have our Navajo gentleman up here helping out Haley. And it's just been amazing to see this team work so hard, and no less in our new quarantine intake barn, which in the video looks so huge, and it's big. Don't get me wrong, it's big. And I'm gonna step outside here just a little bit, less noise. But I just, you know, for this Christmas season, rescuing horses, it's what we do all year round, but it just always seems to be here around the Christmas time. It just seems to be so much more touching, because while the horses may not know that it's the holiday season, we know it is. And having the ability, and you guys enabling us, through your donations, enabling us to save these horses, it just means so much. So thank you so much for your support. We do need more donations. Donations are down a little bit this month. So $5, $10, I know Christmas presents are expensive, and if you can, find it in your heart and in your pocketbook to donate just a little bit for these 23 horses. Maybe donate $23, $1 for every horse we're able to save today. That'd be absolutely amazing. So thank you so much. I'm actually going to go interview a couple other people, see how they think it went. So you'll.
I have something to say.
Oh,
so
okay. Hold on.
I'm gonna take everyone for a little tour. All right, so these horses through here are all done. Their intake is done. Some of them are waking up, and then the rest of the barn down. So we only have this pen left to do, which is really, really exciting. So there's only 4 more horses out here, plus the ones in there. So we're almost done. Moving right along, and this facility has been amazing.
You want to show us the rest of the facility? So this is the outside part.
This is the outside part. Yes, the outside part has been amazing. So if it's raining, or we will get electric up here so at night we can see, but these horses have been able to be calm. They're not in the mud. Like, this has been such a fantastic setup. And then these folks haven't seen the inside yet. Is that what you're saying?
I've been filming all day, but if you want to go through and just kind of...
Okay, I can kind of explain everything. Yeah. So as horses come in, they were unloaded there, which you saw. And then these pens, the way they're designed is I can move this gate and move this horse over here without even like having to handle the horse. So if we have wild horses, we can move them from pen to pen, just moving these gates. Or they can come out this way. When we were ordering them all, like, you sure you want all these gates? You don't want them panels? I'm like, no, we want them gates. And this is why it was really hard to explain what I had in my head, but I knew it would work. It worked on paper, and it's amazing. It's just basically how I envisioned it all working. Obviously, there's a lot of growth that we're doing within here. It's not finished yet, but we can take horses out of any of these pens and bring them down here. This is this area will be redone as well. Like, we just kind of temporarily got it going. But they go into the chute. There's a scale there, and then it goes down to the padded squeeze chute. We will go ahead and walk down here.
I just thought this horse had blood coming from his mouth, and it was pizza sauce.
Hold on,
what is this?
Oh, so she thought there was blood.
Yeah, so I was checking out this horse over here because I thought that he was bleeding from the mouth, and it was pizza sauce.
We've had a lot of pizza sauce.
We don't try to be wasteful. But
no.
These horses really deserve to have a good Christmas too, so we're sharing.
Yes, we're sharing our pizza. There's one station down there because we have 2 vets that we can split apart and do different work. And then there's Nicole. I don't know if we've introduced Nicole in the videos. So Nicole is a vet tech that's joining our team in January. So she's here, she's just volunteering today. So she can learn the ropes, and then she'll be assisting with our veterinarians as a veterinarian technician. We also have Elena here. She is studying to be a veterinarian technician, which is great. We need more large animal veterinarian programs and people out there, whether you're a veterinarian or a tech. Then once the horses go through this system, we're able to take them out a door over there, and then it loops back to the outside. So as we get them done in here, we can put them out there. And we're able to look out these windows and see that they're eating, they're drinking. There's a window on the other side, but from these windows, we can see all the way down either direction. So we're really excited about how all this is happening, and so nice. So nice. Our other building was so small. It was, I think, 24 feet wide. So that is as wide as from this section to this section. So this is how wide basically our entire barn was. And then we had stalls on that side and then the chute on this side, a little tiny area. I know on camera apparently it looks bigger, but this is so much better and so much safer, and really just amazing.
I love it. Ooh. Okay. I'm sorry. Can I have 90 seconds to get this horse pain meds, and then I will give you an interview? Sorry, Tani. That left front looks awful. I'll be right back.
Poor guy's so painful. So painful.
He was just standing eating, so we didn't see him moving, but he's definitely very painful. We're gonna get checked out.
His front leg is a little wonky looking, so it's all right, big guy. It's okay.
While we're waiting for Dr. Lydia, the little baby down there is not even 2 years old yet. The little baby down there is not even 2 years old yet, and just laid down completely exhausted. Very, very tired horses.
Yeah. We are on our last pen of horses. This was our first intake day with our new climate-controlled intake barn. It's been a really fantastic day working in this new facility. I can't wait to be in here when it's completely finished, but the lighting is so much better. The accessibility is better. I felt safer all day, but I think my favorite part about this design is this area, which doesn't look that exciting, but for these guys who came in exhausted, hungry, thirsty, jostling for space, the design has let us put, the little blind pony went by himself and now he has a small friend. It's let us divide up these horses and access them more quickly so that the ones who were painful and needed attention more quickly, we could get to more quickly. So, and then also the way Tani and Jason designed the gates, we haven't had to Rubik's Cube horses around. Like previously we'd have to be like, okay, well we need this horse and we need to move these horses so we can get here. These let us access any of these areas. And so it just makes the stress and the mixing of horses a lot less. So I'm really, really thankful. It was a rough start to the day. We had 3 horses down in the trailer. It's always bad when I cry within the first 90 seconds of intake day. So we had to let 2 of those 3 horses that were down go. They were in really rough shape. But overall, I'm really thankful for our team. We had our new vet tech who's going to be starting in a couple weeks here today, and then we had a technician student here with us, and it's amazing how helpful nurse type hands are to the equation. So Dr. Gina and I feels like a really efficient day, and everybody worked really hard. So we're so thankful for this space. It's going to help us save a lot of horses and provide them with comfort, and it just feels calmer and more peaceful. They're not inside, but they're also not exposed to the elements. So sometimes on intake days it's pouring rain and our unloading area is not underneath, and so they stand in the rain, and I'm just really thankful for their space. It worked great.